Mr. Ramsey D'Souza, our Manager of Epidemiology and Evaluation. We'll get started into the epi summary, and I'll let Ramsey start the presentation.
Thank you, Mike. Good morning, everyone, and thank you for attending this week's presentation. We'll start off by discussing what's happening in Canada with our cases, move to what's happening in Ontario, and wrap up with what's happening locally in Windsor-Essex. So let's begin. Currently in our fourth wave, cases across Canada have been decreasing for the past couple of weeks. Currently in the past week, we were averaging about 3,500 cases a day, whereas in the week prior to, we were seeing about 4,000 cases a day, so a decrease of 500 cases on average per day. When we move over to Ontario, we see that in our fourth wave, our curve isn't as steep as what we're seeing across the country in Canada. Our 7-day average currently is 525 cases a day, and this has decreased from last week where we were seeing about 576 cases a day. So about a 50 case decrease from this time last week. When we move over to Windsor-Essex, we too are seeing a decline in our region. Our current 7-day average is 34.6 cases a day. This is once again a decrease from last week where we were seeing about 40.3 cases a day. When we look at our weekly average for the most completed week, which is week 40, 2021, our most completed week's rate is 50.4 cases per 100,000 population. Once again, this has decreased from last week where we were at 56 cases per 100,000 population. When we look at the most recent 7 days, our case rate is 47.2 cases per 100,000 population. And once again, this too is a decrease from last week where we were at 53.2 cases per 100,000 population. So how do we compare with other jurisdictions? Our case rates are starting to decline, and we are starting to catch up to where our rates should be with the province and with the other PHUs in the Southwest. If you notice in the last couple of weeks that we have seen a slight increase in cases in the Southwest, which is the green line, and that's because other areas in our region have seen a marginal increase in their cases. So looking at the most completed week's worth of data, our case rates have decreased. This time last week we had the second highest case rates for the most completed week, and currently we're now in third place, only to be surpassed by our neighbors in Chatham-Kent and in Lambton. When we look at our wastewater surveillance data, in general, there has been a decline since the beginning of the fourth wave. However, in the first 2 weeks of October, we have noticed an increase, though there has been some fluctuations too. We might see more cases as a result in the next coming 3 to 5 days as a result. Looking at our percent positivity, our most recent percent positivity is 4.0%. This has increased slightly from last week where we were at 3.5%. So when we look at our most recent 7 days, we have the second highest percent positivity in Ontario, only to be surpassed by Chatham-Kent. We though are higher than the entire province as a whole. When we break down our percent positivity by age groups, in the past couple of weeks, we were seeing a decline in our 0 to 17 age group. However, in the most recent completed week that we have, which is, if you look at the dark blue line, we have seen an increase now in our percent positivity. Whereas in the other age groups from 18 to 65, they either have remained unchanged or have seen a decrease. When we look at our case rates by municipality from the month of October onwards, Essex and Leamington, followed by Tecumseh, have the 3 highest rates in our region. When we strictly look at the number of cases distributed by municipality in the past 30 days, 54% of our cases are from the city of Windsor. This, compared to what we're seeing during most of the pandemic, is a decrease where we're seeing about 60 to 65%, sometimes even 70% of our cases coming from Windsor. We are seeing more cases in other areas, such as in Leamington, in Lakeshore, and in Essex. In the most recent 7 days, 50% of our cases, or just over 50% of our cases, are from the city of Windsor, and 11% of our cases are from Essex, 14% from Leamington, and 10% from Tecumseh. We are seeing more distribution of our cases in our county municipalities. When we look at our overall age and sex breakdown, in the past 2 weeks, 34% of our cases have been among those 0 to 19 years of age. This has increased from the previous weeks where we were hovering at about 30% to, whereas if you look at the entire pandemic, only 15% of our cases were among those 0 to 19 years of age. When we look at how our cases are acquiring COVID-19 from October onwards, we see that almost 40% of our cases are acquiring the virus from their household contact, and just under a quarter of them are acquiring from an unknown source or from somewhere in the community where they cannot identify that source. When we look at our school-age cases specifically, you'll notice that in the most recent 3 to 4 weeks or so, during our fourth wave, while our numbers have declined from the peak, they do remain relatively unchanged for the most part, indicating that yes, we are seeing cases in that age group in our school-age children. And while we are hoping to have a decline, having it being relatively unchanged is something that is a concern for us. When we compare our 7-day average for our school-age cases to those of the overall population, you'll notice that our 7-day average for our overall population, Windsor-Essex, which is the blue line, is declining, whereas in our school-age cases, though we've seen a huge drop from its peak, it does remain relatively unchanged. Moving on to our hospitalizations in Ontario has generally remained unchanged, though we have seen a decrease this past week. And same for what we're seeing in Windsor-Essex. Hospitalizations in the regions are starting to go down, though in some cases it has been incremental. When we look at our ICU, the ICU hospitalizations for Ontario have been decreasing, whereas in Windsor-Essex we have seen some fluctuations, but they remain higher to where they were for most of this fourth wave. When we look at our doubling time across the board in Canada, Ontario, and in Windsor-Essex, our doubling time has improved and is trending upwards. When our doubling time is increasing, that means that the virus in the region is slowing down from its spread, meaning that less people are being infected over a larger period of time. Our most recent estimated median R0 is 0.88. This is a slight decrease from where we were at last week, where we were at 0.96. When the R0 is less than 1, it means that each infection leads to less than 1 new infection, signaling a decrease in our cases in our region. Moving over to the vaccine side. Looking at our vaccine administration from September 1st onwards, the 7-day average as of October 12th for doses administered was 701 doses per day. This is a drop from where we were last week, where we were administering just over 900 doses a day. This is a better visualization from September onwards. If you look at the green line, which is our 7-day average, you'll notice that it has been decreasing since the beginning of September, though we have seen some peaks at times. When we look at our age distribution, we have seen some improvements in our 12 to 17 years old for first dose administrations, where 74% of those 12 to 17 have received at least 1 dose, though there is still some work to do among those in our 18 to 24-year age group. Overall, we have a much higher coverage rate for first doses in our older age groups, especially those in our senior age groups. And overall, for those 12 plus, the coverage rate for at least 1 dose is 84.3%. When we look at those that are fully vaccinated, once again, we have seen some improvements in our 12 to 17-year age group, though it does remain fairly low compared to some of our older age groups, especially those in our senior age groups. Our overall coverage rate for those 12 and above is 79.3%, just under 80%. When we look at our hotspot administration, including those in children who are not eligible for the vaccine, our coverage rate is higher in some areas, such as N9B and N9Y, and low in other areas, such as in the downtown area, which is N9A. Similarly, looking at those that are fully vaccinated, there is some work to do in our downtown area, whereas in some of the other regions, such as N9Y, we are seeing higher coverage rates for those fully vaccinated. So how do we compare with other regions in our province for first dose administrations among those 12 plus? We are once again and still continue to be in the bottom half of the province, where our coverage rates are below the provincial average. And when we look at our second dose coverage rates for those 12 plus, it follows the similar trend to what we're seeing in our first doses. We are below the bulk of the PHUs, and also below the coverage rate for the entire province as a whole. In summary, case rates in Windsor-Essex have decreased this past week, though they do remain high when we compare it to other PHUs in our region. Our waste for surveillance data indicates an increase this past week, though we have seen some fluctuations. Just as you mentioned last week, there is a disproportionately higher number of cases in our children and youth. Hospitalizations for COVID-19 have decreased this past week. The number of doses administered this past week has also decreased. When we look at our monitoring indicators, our case rates have decreased for this current week. For our most recent completed week, our case rates are 50.4 cases per 100,000 population. In the most recent 7 days, it's 47.2 cases per 100,000 population. Our percent positivity is hovering at 4.0% for the full week, and in the most recent 7 days, it's slightly lower at 3.7%. Our R0 is 0.88, and our outbreaks in our region remain high at about 24 current active outbreaks that Health Unit is following. Our coverage rates for one dose for those eligible 12 plus is 84.3%, and 79.3% for those 12 plus that are fully vaccinated. Thank you, everyone.
Thank you, Ramsey. We'll now take questions from the media. Today we'll start with Taylor from the Windsor Star.
Yes, good morning, Doctor, and good morning, Ramsey. No big questions today. I guess I'm just wondering if there's anything in the data this week that's surprising to you or that you didn't expect to see happening.
I can begin. For me, I think the biggest takeaway was, we, even though rates are decreasing across the province, our rates continue to be high, and we are seeing a stable number of cases in our school-aged children as well, which is reflected in the number of outbreaks that we see, and also in the number of dismissals that we have as well. Whereas across the other age groups, 18 plus, there has been a general decline among those cases.
Yeah, the one thing that I would share is that we're cautiously optimistic. The burden of disease is less now than it was a few weeks ago. However, Windsor-Essex is at the highest level of disease burden when compared to other districts. And also, young people are disproportionately affected. I think Ramsey had highlighted to me that I think it was about 250 classes of young people have already been excluded from school in this academic year. Is that the correct number, Ramsey? About 250?
That's right. Yeah.
Yeah. So there have been more young people excluded from school this year, in this early part of this academic year, than all of the fall semester of the previous year. And that's something that still remains surprising to me.
Thank you both.
Any questions from Rob at Tammy 100?
Ramsey, I'm not sure if you have this, just going off the point about the 250 classes dismissed. Do you know how many students that is?
Not readily off the top of my head. I'm sorry, Rob.
Yeah, Ramsey, are we able to give an estimate of that later today?
Yes, for sure. Yeah, I'll work with Mike to send a more accurate number.
Appreciate that. Ramsey, I asked you this question last week, just then you mentioned in the summary about the number of doses have decreased. Do you have I guess what we were at this past weekend, and then compared to last weekend, does Thanksgiving weekend play a factor into that, you think?
We did see a drop on the 11th, which could impact the number of doses. I think during that day we were administering only about 170 to about 230 doses overall, which is an anomaly, and it could be because of Thanksgiving.
And sorry, going back to the classes, Doctor, just the 250, like you mentioned, and like you said, we're seeing cases in that younger category. I know we ask this all the time, but obviously concerned, worried that 250 could increase even more.
Yeah, we're always concerned that the additional classes of young people will be excluded from school. I think it's an important public health priority to try to keep schools open for instruction, and that's been a key goal of the local public health service. I think that it's particularly important to increase the vaccination rates among young people. It's an entirely achievable goal to the extent that vaccines that are covered under the Immunization for School Pupils Act, vaccines like polio, we have approximately 90% of the young people vaccinated. With COVID-19, I think the number is probably closer to 70% right now of young people. If we can bridge that gap between 70 to 90%, then I think we're in a better position to manage from a public health point of view, and are more likely to keep schools functioning.
Thank you.
Any questions from Bob at CTV? Bob, you may be muted.
Yeah, you know what? I was. Sorry, guys.
No
new to the new regime. Hello, everyone. Nice to be here. Just want to touch base on Doug Ford. I guess he's expected to lift some restrictions today for restaurants, bars, gyms. Just wanted to get your thoughts on that. What do you anticipate? Do you support if that does happen?
Yeah, it's difficult for us to comment on what will happen, and once there is a provincial announcement, obviously we'll be in a better position to comment on that. My general feeling is that the level of public health, the measures have to be concordant with the public health goals, and I think that's what we hope for as we move forward.
Okay. Do you think maybe just loosening up a little bit? I don't know. It depends on what he says, right? So really, there's no directive from your end, is there?
Right. I think we have to wait and understand what the new provincial direction is, and then we'll be in a better position to comment on it at the local health service.
Okay. Maybe a question for tomorrow then, or next time.
Thanks. Sure enough.
Any questions?
Sorry, Mike, you were cutting in and out.
Oh, any questions from Carrie at CBC?
Yes, good morning. My colleagues at CBC have learned that the provincial government is going to loosen the restrictions, and the specifics of that is that they're going to be eliminating all capacity limits in settings that currently require vaccination. Just following up on my colleague's question here, given our current situation, do you have a response to that specific change? Are we ready, or do you think it would be best to stick with the status quo?
Well, I'd like to wait and see what the actual announcement from the province is. I'm not aware of. I've not been given any. I'm not aware of what's going to be in the announcement, and we're always cautious as on the public health service. So we'd like to reserve our comment on that specific public health direction when it's been publicly announced.
I understand. And now that the end of the border closure is in sight, there's been calls for Canada to harmonize its rules with the U.S. surrounding the pre-testing requirement for returning travelers. Now, I know that public health doesn't set these rules, but I'm curious about what your take is, whether you think it would make a meaningful difference from a public health perspective if Canada allowed, travelers to come into the country or back into the country without doing that pre-screening test.
No, thanks for the question. I think that how the border is managed and how people are allowed to travel between the two countries is really a federal matter and not a local health district matter. The one thing we say as a general principle in public health is that we want to have clear, simple, and easily effectuated public health policy. So to the extent that, my preference would be that whatever framework or process that's implemented, it should be easily achievable and easily understood by the people that are being served.
Okay, thank you very much.
You're welcome.
Any questions from Elvis at Radio Canada?
Mike, you're breaking once again.
Okay. Any questions from Elvis at Radio Canada?
Yes, Mike. Hi. So my first question is actually regarding the outbreaks in three French schools in the region, Louis Charon, Saint-Ursule, and Georges Pévanier. So I would like to know if you have any status, if you know what is happening now in these schools, these three French schools.
Well, we continue to have dialogue with school board officials on a regular basis, and particularly when there are cases or clusters of cases at schools themselves. I can't really comment on the specific details of those schools, but perhaps you can reach out to the school board officials who generally manage the media messaging related to schools and cases at schools.
Okay, thank you. So that's pretty much everything you can say. You have no idea when they will be allowed to open or how?
Yeah, so whenever we manage a group of cases, clusters, or outbreaks, we make individual level plans working with the school board, and it's a situation that might change from time to time. I think, though, to give the most accurate information about those, I would suggest that you reach out to the school board officials and have dialogue with them. As a general construct, opening a school involves not only the public health guidance, that is the school currently safe enough to return to students returning to in-person learning, but also can the school operationalize the opening at that particular date? So do they have enough staff? Have they done the sufficient cleaning? And so it's a bit more complicated process than just the public health process alone. But to the extent that you would like the most up-to-date and accurate information, I would suggest reaching out to the school board's media relations team.
Okay, thank you.
You're welcome.
Any additional questions from Windsor?
No, thank you.
Any additional questions from AMA 100?
Doctor, just one. I know last week when we talked about extracurricular activities and the recommendation to come up with a policy, like you and Nicole mentioned, the health unit will not have to approve that policy. But I guess just the past week, has the health unit been working with the school boards on those or seen those policies?
Well, we continue to work with the school board, its officials, and its administrators, and we meet with them on a regular basis. I think the meetings are typically every week at the current time. The public health unit's recommendation is that they formulate policies. So long as the policies meet the broad guidelines or the broad suggestions, they don't necessarily need specific public health service approval. But I anticipate that school boards are working to finalize their policies moving forward.
Thank you. Have a good day.
All right. All the best.
Any additional questions from CTV?
Yeah, actually, Doctor, just a follow-up on Rob. How specific do these policies have to be? You know, 'cause I'm just wondering, like, do they need a 10-pager? You know, is it a 1-pager? Like, is it going to take them long to do it? That sort of thing.
Well, the formulation of policies and procedures and the related documents is for the school board and its officials to prepare. You know, different institutions have different levels of detail. That being said, I don't think it has to be a particularly complicated or exhausting document. In general, in the public health service, we want to give clear, easily understandable, consistent guidance, and so I think that's what the school board officials will be working towards as they promulgate their policies and procedures on this item.
Okay. Do you anticipate maybe like in a week or two from now, or is this going to be a long drawn out, perhaps in the next month sort of thing?
Yeah, you know, I think that as it relates to school board policy and school board practice, it's best to reach out to media relations at the school board.
All right, no problem. I'll check in. Thanks.
Okay.
Any additional questions from CBC?
No, thank you.
Any additional questions from Radio Canada?
Oh, no, thank you. Have a good day.
Okay, thank you, everyone. We'll see you on Monday, October 18th.
All right. All the best.
Thank you, everyone.
Cheers.
Bye-bye.